Hi, everybody. So today let's discuss fibroids and pregnancy, the interaction. So it's important to understand what fibroids and pregnancy share when they're together. So fibroids normally don't cause issues with getting pregnant. So fertility is normally not an issue, and very many patients get pregnant while they're having fibroids. And even as we speak, I do have very many patients following up in the clinic with fibroids. But it's important to know that there are times when fibroids and pregnancy can have an interaction, and it's not always good. They are not always friends. So fibroids can impact pregnancy, and pregnancy can impact fibroids. Let's discuss impact of fibroids on pregnancy. Number one, if they're very close to the tubes or the cavity, they can cause fertility issues. And if that is circumvented and someone does get pregnant, then the risk of miscarriage can be higher in fibroids than in the normal uterus. And that is because of interaction with sometimes the implantation that can be impacted as well. Number two, if we don't have a miscarriage, which we have to be careful about, then preterm labor can be an issue. Preterm rupture of membranes can be an issue. Malpositions of the baby can be an issue. Difficulty in labor with dystocia, so challenges with labor because of the malpositions can be an issue. And the progress and because of the contractions not being very, synchronized because they are different fibers in different location. In normal uterus, it's all synchronized going towards the cervix. In this, it's not. And if they therefore can have a higher chance of operative deliveries, including cesareans. And with that, when they are fibroids, even if they have had a normal delivery or a cesarean delivery, they do have a higher risk of bleeding more than normal and postpartum hemorrhage, PPH, reason being that they would not allow the uterus to to retract very quickly, and that is how the uterus stops bleeding after delivery. And sometimes, therefore, after, it causes anemia related to the same and subinvolution, which means the rate at which the uterus now goes back to its normal size would actually be slower than if there were no fibroids in that uterus. So that's how fibroids impact for pregnancy. How do pregnancy impact fibroids? One is they could increase the size of the uterus, size of the fibroids in pregnancy. And the second one is that you may sometimes get degenerative changes of the fibroid in pregnancy. One specific type of degeneration called red degeneration happens in pregnancy and causes pain. So these patients would have a constant issue with constant pain, not labor-like pain. And the solution to this most of the times is a little bit of rest, hydration, and some painkillers which are safe in pregnancy. So fibroids can grow and can undergo some degenerative changes in pregnancy. Thank you.